Here we present our work that is published in Lancet Oncology on repeated opening of the blood-brain barrier through an implantable ultrasound and administration of albumin-bound paclitaxel in patients in recurrent glioblastoma. This is a phase 1 trial that we conducted at Northwestern University in Chicago. When treating infiltrative brain tumors, the penetration of drugs across the blood-brain barrier is a major challenge and an impediment to successful treatment. Most chemotherapy agents will not cross the blood-brain barrier and thus cannot reach the tumor where it sits. One exception to that is temozolomide, the only drug that has really been recently shown to have some efficacy that has actually been designed to cross the blood-brain barrier. Yet we have many more agents, much more active agents like paclitaxel that could be used to treat brain tumors.
An approach to overcome the blood-brain barrier and get drugs into the brain where these infiltrative tumor cells lay after resection is to use an ultrasound device coupled with microbubbles. The way this works is that ultrasound waves hit the brain at the time where microbubbles are circulating in the blood vessels. These microbubbles then agitate, oscillate, and cavitate and transiently open the blood-brain barrier and allow passage of drugs into the brain parenchyma. Application of these to humans is difficult because the human skull is thick and sound waves need to either bypass these or overcome the thickness of the human skull. A French company named Compr has come up with a skull implantable ultrasound device. What we do in order to use this is we perform surgery to remove a tumor of a patient with recurrent glioblastoma or with glioblastoma, and instead of plating the bone flap at the end of surgery, we implant this device. Surgery is then concluded. Patient goes home, and a few weeks later, when we want to open the blood-brain barrier, we can use a needle and a cable to connect this to a source of energy and activate the ultrasound, while we at the same time inject microscopic bubbles followed by chemotherapy. By doing this over 4 minutes in the outpatient setting, we can open the blood-brain barrier and deliver drugs into the brain. This video demonstrates the dynamic opening of the blood-brain barrier intraoperatively. Following brain sonication and administration of intravenous microbubbles, we also injected fluorescein intravenously, as this dye does not normally penetrate into the brain. We first observed fluorescein in the arteries, then the whole brain was fluorescent as this dye was in the capillaries, followed by clearance of these in the brain veins. Eventually, after a few minutes, we observed clearance of fluorescein, but accumulation of this dye in the brain regions that were sonicated where the blood-brain barrier was open. In our study, published at Lancet Oncology, we described the results of a phase 1 clinical trial where we used this skull implantable ultrasound to deliver albumin-bound paclitaxel to the brain of patients with recurrent glioblastomas. We did this procedure every 3 weeks. As part of this study, we performed intraoperative sonication to learn about the pharmacokinetics and the effects of this technology in the human brain. What we learned is that paclitaxel can increase its concentrations in the brain by 3.7-fold when you sonicate, and carboplatin, in collaboration with a study performed by Alexandre Carpentier, we learned that it can increase its concentrations by 5.9-fold. Something really interesting we learned is that the blood-brain barrier integrity is quickly restored after sonication, with most of the restoration happening within the first hour. This really points at a critical time window in which drugs need to be circulating in the blood in order to penetrate into the brain.